Welcome, everybody. Thank you very much for joining us today. I'm Mike Marchinetti. I'm the VP of Strategy and Business Development at Examinetics. Before we get started, just a couple points of housekeeping. Just so everyone's aware, we do have microphones disabled, and same with the chat. But you'll see in the top of your screen, there's a Q&A feature. We would love to have questions as we go through this. So please, if something comes up, just type in a question, submit it to us. We're monitoring it throughout the discussion, and we'll make sure to address anything that comes up. We'll also have a Q&A session towards the end of the discussion to make sure we catch everything. So as I said, thank you so much for joining us today. My name's Mike, and I'm joined by my colleagues, Mike Pelz, the VP of Health and Safety Solutions, and Sandy Schmitz, an RN and board certified occupational health nurse. Sandy's also our Director of Injury Management Services. Mike and Sandy have graciously allowed me to pull them away from their day-to-day for a bit so that we could discuss ways in which a proactive approach to injury management can reduce costs and recordables while improving employee satisfaction and outcomes. So, we see a lot of familiar names out in the attendee list today, and Mike, Sandy, and I are constantly speaking with our customers. And we know the challenges that workplace incidents and injuries can create for you, your employees, and your bottom line. So we wanted to have this discussion today so that you can see how a comprehensive approach to injury management can help you, reduce recordables and shift from a reactive, costly and administratively burdensome solution to a much more proactive and cost-effective one. So, Mike, just to get us started, I know that despite everyone's best efforts, incidents do happen. Our clients have dangerous sites and lots of hazards. So, tell me a little bit, what exactly do we mean by an injury management program?
Thanks, Mike. Yeah, from an injury management program, it's really changing things from a philosophical standpoint. It's looking at injuries from a proactive standpoint versus traditionally what people do, which is reactive. Injury occurs, they treat it. What we try to do is set the foundation and set up a program in totality so that we can not only improve the employee experience, but then obviously positively outcome the client as well. And part of that is what can be done as far as looking at injury prevention. Obviously, the best injury is the injury that doesn't occur, and looking at trend analysis as to the root cause of why these injuries are happening, especially if there's trends and tendencies, and preventing them from when they happen. Another part of things is from a response time. And this is one of the things that as I've worked with Sandy over all the years, it really is amazing that when an injury is reported in a timely fashion and medical treatment can start in a more proactive standpoint versus 8 hours, 12 hours, 24 hours later, typically the plan of care associated is significantly different. But you've got to ingrain that into your culture. So you've got to get your employee buy-in so that they're reporting things in a timely fashion so that we can have more positive outcomes.
So
Making
Mike,
sure that, yes, please.
What I'm hearing is there's a lot more than just incident response, right? There's what else goes into it?
So part of it is making sure that you fundamentally set up your job descriptions properly for the injury management team, making sure that not only your injury management provider understands the job descriptions, but what are the physical requirements, the frequency in which they're performed, the environments and the shifts they work. These are all things that really play into this, especially as you go from the aspects of treating an injury through, say, the tele-triage, which is a remote access program, to case management. Having been that we owned and operated our own occupational medical clinic for years, our doctors always said the more information they have, the better they can perform on behalf of the employers. So these are parts of that foundation that you have to do on the front end, as well as understanding, do you even have a light duty program in place? Do you have peripheral functions as part of that we can tie into from preventing time loss type scenarios?
So what I'm hearing is a very comprehensive approach. What are the impacts and outcomes that this type of all-encompassing program delivers?
The top ones that I always talk about, and I'm sure Sandy will add to this as we go through, the main one that we always try is employee satisfaction, because the thing is, when an employee feels like they're getting the proper level of care for the injury they sustained, they will be more compliant, they will adhere, they are more willing to participate in the different offerings that the company has presented to them. By incorporating things like tele-triage plus a much more proactive case management program, you are going to see a significant reduction in costs, not only in the treatment itself, but by lowering those experience modification rates and how it also impacts your insurance premiums. And if you're the type of company that bids projects because you do site-based work, typically companies with lower experience modification rates also can acquire additional business. So you're going to see a direct impact from a cost saving standpoint, not only in the cost to treat the injury, but when you properly implement a tele-triage program like ours that's physician-based, where you can maintain 60% or so of your injuries under tele-triage, that also means you don't have employees leaving the job site for treatment. You don't have that commute time to and from the clinic, the time they're at the clinic. On average, you're seeing a production gain of 2.5 to 3 hours per treatment visit that you gain through a tele-triage program. And these all come into that return on investment when you properly structure your program.
Got it. Okay, so there's a lot more that goes into it than just per incident cost savings. But I think if I heard you right, one of the big advantages is reducing recordables and having that impact on experience modification rates. But Sandy, tell me a little bit more. How exactly does an injury management program reduce recordables?
Absolutely. Thanks, Mike. So our physician-led medical team actually uses our first line of defense as that tele-triage program. With that tele-triage program, we are able to keep approximately 60 to 70% of all incidents under the first aid tele-triage umbrella. So these employees never require a clinic visit. You don't incur the cost there, and everything stays first aid.
Got it. Well, thank you, Sandy. And I just noticed one of our participants raised a hand. If you do have a question, please, drop it into the chat. Would love to address it. So, Sandy, I think I heard you mention 60% of incidents are staying as first aid in tele-triage. Mike, I know you mentioned a few other benefits, but I can see fewer clinic visits. I'm sure it does help reduce costs, but how much can a program really save?
So when you look at the typical treatment cost for tele-triage versus clinic-based, and we go a lot by the occupational disability guidelines that publishes a lot of these statistics, we find that tele-triage is typically 40 to 50% of the cost of a clinic-based treatment for very similar type injuries. In addition to that, when you use a traditional tele-triage program versus, say, telemedicine or telehealth, everything that's done under tele-triage falls under the first aid umbrella. So in addition, you are actually now keeping everything under the first aid umbrella, which has the benefits above and beyond. Typically then, because it's stayed under tele-triage, these are also cases that don't need to be reported to your insurance carrier, which means your frequency of reporting goes down, again, positively impacting your mod rate. But for a lot of clients too, it's the convenience factor. It really is, because a lot of clients are working shifts outside of normal work hours. They work 24/7, they work weekends. Finding proper occupational injury management care after hours is very difficult. Most companies have to resort to using the emergency room, or people who are not familiar with the different recordable statuses out there, whether it be through OSHA or MSHA. And we are allowed to be able to adhere all of our philosophies and our years of experience to, again, find that really good balance between good employee care while protecting the interests of the clients. And this really eliminates things like over-treatment. It allows us to adapt the program back and forth between tele-triage and case management to the betterment of the employees. And as part of that, for some of our clients, We can even incorporate things like claims investigation and claims administration to make sure that they're only accepting claims that are truly their responsibility. And if they're self-insured or have a high deductible plan, using our claims administration program for those claims they don't want to submit so they can take advantage of our discounted fee schedule, again, positively impacting the overall cost structure of the program.
So, Mike, is it fair to say then, from just from what you're mentioning there, year one cost savings are upwards of 50-60%? Is that, when you add it all up, is that about right?
Yes, and what you'll see is over the 3-year period, because if for those of you who are familiar with how the experience modification rate is calculated, it's a running 3-year tally. What happens is you are going to see those numbers increase year over year, because as you continue to drop off those negatively impacted years, and now you have what we consider clean or polished years, now that's when you're going to start really seeing significant differences in your overall cost as you keep on dropping off year after year.
Got it. Thank you. But I thought I heard you mention something important there, and that's employee experience, right? And so, Sandy, I know you said about 2/3 of incidents stay as first aid, tele-triage, but what's that like for the employee? Is this as good an experience?
It is. There's a great experience for the employees because they're able to be, with a simple phone call, connected to a live clinician. That clinician will then go through a comprehensive assessment as far as the injury goes, including the mechanism, time off work that they may have before and after, and anything that may have contributed to that incident. Because they're able to speak with a live clinician, they also build that trust with them, which helps with the further follow through.
So follow through, what do you mean by that?
We ensure that the employees have post-care, so it's not just one call and then done. They get multiple follow-up calls to ensure that they are meeting their goals for this and that they're getting back to 100% as quickly as possible.
Wait, so you're saying even with first aid injuries, we will call and follow up 2-3 days later?
Absolutely. We will make sure that they understand the process, what's going on, and kind of redevelop that plan of care as they progress through the injury.
Oh, great. Okay. I knew we did that for clinic visits. I didn't realize we did that for first aid treatment. So glad I joined the webinar. This does sound like a lot of care, though. So, Mike, I think you mentioned there's a difference between tele-triage and telemedicine. Can you just elaborate on that a little bit?
Yeah, so there's 3 different classifications that come around teleservices. You have tele-triage, telemedicine, and telehealth. And it's very important that you identify which vendor you're working with. The reason we kept everything under tele-triage is because it is that. It is a triage. It is basic first aid care developed and implemented by a medical professional. By keeping it under tele-triage, it does ensure that everything we do stays under the first aid umbrella. When you have a service that gets into telemedicine and telehealth, those are physicians that are typically then able to provide things like prescriptions and different plans of care that may take it into a recordable status. And it's very important that they've identified which of those resources they're utilizing. And we've seen clients over the years be very surprised when they're using these teleservices when somebody says, hey, I thought that everything was going to stay under the first aid umbrella. Well, if you're using a telemedicine service, then from that standpoint, they might prescribe something that creates a first or a OSHA recordable or an MSHA recordable event. So it's very important as you vet these services that you truly understand what you are actually acquiring in your partners as you go through the process.
Got it. And Sandy, your team, we're doing tele-triage, that's right?
Absolutely.
Yeah. And so it's tele-triage and then case management and beyond, right? So I know we do a nice job of keeping injuries under first aid, but sometimes accidents are pretty severe. and people do need medical treatment. So, Sandy, tell me a little bit about what happens when your team decides that an employee does need to go get care.
Sure. Once we've identified that they're not a candidate for the tele-triage program, we will work with one of our over 7,000 clinics in our clinic network that have been personally vetted, sourced and vetted to ensure that they're meeting Examinetics standard of care. So including communication guidelines, reporting guidelines, ensuring that they get us the paperwork on time, and that they have a provider that'll work with us.
Interesting. So when we have a call come in from an employee, we triage it. We say they've got to go to the clinic. We're actually calling ahead and making sure that they're ready to receive the employee.
Sure. We will handle the scheduling, the getting the employee all of the proper documentation needed. We'll also speak with the provider that's going to be seeing the employee to ensure that they have the background of the incident, any contributing factors, as well as what has happened so far.
Okay, so I got to be honest, Sandy, my uncle is a doctor and I love the guy, but you can't tell him anything, right? So are these clinicians really willing to work with us?
They're very willing to work with us. In fact, they appreciate that we are making that call to give them a little more insight into the injury. It makes a difference because it's medical professional to medical professional, and not just medical professional, but we're also considered occupational health experts in this industry. So having that communication with them is very much appreciated.
So what's the benefit, of that occupational health background? How does that help as we work with our clinicians to guide a course of care?
We are able to give them some tips and tricks for how to keep things non-recordable. So getting the employee the most appropriate care in the most conservative manner possible, and ensuring that they're doing things such as OTC medications whenever appropriate instead of a prescription medication, using a lace-up brace instead of a rigid splint. As long as the employee, we're not over-treating.
I see. So, I mean, those sound very similar. How is a healthcare provider supposed to know the difference?
They don't. That's why we exist.
Got it. Well, that's really helpful. Thank you for explaining the case management component. So, Mike, tell me a bit more, because I know you mentioned at the beginning, there's a lot more to injury management than just incident response. So we work with clients across a wide range of industries and maturities. I can't imagine a one-size-fits-all approach works here. So tell me what else goes into it.
Yeah, and you're right, Mike. And really from our standpoint, it's really understanding our clients. And there's a lot of different variables go into play. We have some employees that have a union workforce versus a non-union workforce. You have other contributing factors where you have an employer who has CDL drivers versus non-CDL, and that ties into our post-accident drug and alcohol program that we do as well. And that's really important. And that's where you can also tie into our subject matter expertise, because a lot of times somebody might be in an accident and they are a CDL driver, and our clients, especially who may be dealing with something after hours, doesn't realize or just doesn't understand the federal regulations of when do I need to do a federal drug screen versus a non. And these are the things that we can assist with to make sure that they are taken care of properly. And it isn't it's not a one size fits all. We don't make our clients fit into a box. We modify our box to fit our client, and not only a client, but each one of our clients' facilities. And I think that's really important to look at as well. Is that how do we develop this? Because you have different state regulations. You have states that are panel states. You have states where companies get to really have a lot of control over directing care. Like the state of Indiana is a wonderful state. You get to direct care for the first 500 weeks, where in the state of Illinois, you get to direct it for the first visit. Knowing all these different regulations also changes our approach of interacting with the employees as well. Because again, we want them to consider us their advocate through this process so they get the most positive outcome with that. So as we work through these things, we will develop the program. If we find out that the client doesn't have good job descriptions, we can help them develop those. We are very fortunate to have a certified ergonomist on staff that can help us analyze trends and even modify training routines so that we put people into a position where they don't sustain injuries. And these are the things that we are constantly doing. It's just not upfront. This is a constant interaction we have with our clients day in and day out so that we can improve the outcomes on their behalf.
Got it. So you talked about job descriptions, hiring parameters. How does that impact a injury management program? That seems very far afield.
Well, it's one of the things that myself and Sandy and Dr. Masana, our medical director, do on a regular basis. A big part of what we do is what we call the trend analysis, and it really starts when we evaluate our company's loss run data, their last 3 years. It gives us a good understanding of the types of injuries that they're sustaining, but more importantly, it also determines when are those injuries are happening. And there was a situation not too long ago where Sandy and I were evaluating a client, and we saw that something like 62% of their injuries were happening within employees being on the job for their first 90 days. And if you looked at the physical requirements of these employees, it was pretty strenuous. And when we evaluated it, one of the things that we presented to our client that they adopted was changing how they do their onboarding of new candidates. They actually chose to implement a physical ability testing specific to every job description, so it meets all the ADA and the EOC requirements. And the idea now is not only are they hiring people that can physically handle the nature of the job, but even if somebody was being brought in for a position and they don't meet the requirements, they may have met the requirements for another job position. So they were actually positioning candidates in the right role so they can be very productive for them. So that happens on the onboarding of new candidates. And then you can tie these things into like your return to duty and fitness for duty program, making sure when people are coming off of work from a non-work related incident, they meet specific medical criteria so we can help eliminate those aggravation of pre-existing conditions, as well as creating a mechanism where when supervisors of that employer may have concerns about an employee being able to perform the essential functions of the job, we can assess those employees before they turn into a work related. So as you can see, it really turns into a total solution for the client.
Got it. So it is quite comprehensive, and the impact of all that, I get lower recordables, but you're also saying reduce time away from work, preventing injuries before they even occur.
Absolutely, and that's the biggest thing is that most companies are trying to achieve a certain level of efficiency per employee per day. And I would say most companies, try to target anywhere between 70 and 80%. Well, when you hire somebody who has the physical capabilities to perform the essential functions of the job, you're going to achieve that milestone. Where if you're hiring somebody who's having a difficulty performing those functions, they may only produce at a 50 or 60% rate. Well, you have a facility of 500 people and you look at that performance difference of 20%, that makes a big difference on the productivity of your operations. And these are things that a lot of times people don't think about in that context of how it will not only impact reducing injuries and time away from work, but productivity, because you put people in the right position to be effective in their roles.
Got it. So tell me a bit more about preventing those future injuries and root cause analysis. I know you mentioned that is a big component as well.
It really is. And, these are the things that Sandy and myself work with Tony Marquez, who's our certified ergonomist. And really what it is that it's evaluating not only what is required of the employee, but how they perform the tasks. And we've been involved in this several times where we'll go out to a job site and we'll evaluate 5 people who are supposed to be doing the exact same job position. And we watch them do a task and they are all doing it completely differently. It's like one person trained another person, that person trained somebody else, and before the end of the day, they don't even look like they're performing it. And typically what it means is they're using improper mechanics. Improper mechanics lead to injuries. We can formalize the training program so everybody is doing it the same way. They're doing it functionally sound to prevent injuries. In addition to that, a lot of times our clients aren't even aware of some of the tasks they're being asked to do and the physical requirements. We just recently ran into that on a study that we did where it says specifically in their employee and safety handbook that anything above a 50-pound lift has to be an assisted task, 2 people or more. Well, when we went out there to do the assessment, we actually identified 3 different tasks where the employees are expected to lift more than 50 pounds by themselves. And they weren't aware that through the years, the process has changed. And because the process changed, the parameters are changed. Being able to do this on a routine fashion when your processes change, ensure that we are not asking employees to do functions that are above and beyond what is written in their policies. And that's very important as well.
Got it. So when you say that comprehensive program, it's things that happen before incidents, it's incident response, it's claims administration after the fact. It sounds like there's a lot that goes into this. How hard is this to really put into place? What does it really take, Mike?
It really, I think we've been probably doing it for so long that it's become a scenario where I feel like we're very efficient in doing it. When Sandy, myself, our program development team get involved dealing with clients and we get to understand what their work environment is, what their challenges are, what they're trying to achieve, it actually becomes a much more simplified process than it probably sounds through our discussion today. And it is a lot of questions on our part, and I'm sure some of our clients get a little annoyed with the level of granularity we get into, but they really do prove to the outcome. If you look at most programs, depending on the size and nature of it, we are typically onboarding new clients for injury management anywhere from 15 days to about 45 to 60 days, depending on how many job sites they have, the different variants that they have. Sometimes we have to deal with clients that also have to interact with something like an OSIP program, which is an owner-controlled insurance program. There are variables, but we know how to navigate that. So the goal is that, yes, we need critical information from our clients so that we can develop the program, but really most of the implementation is on our part, and that's our position to implement that on behalf of our clients. So really, besides some key information they provide us, we really take on the overall program development and implementation on their behalf, which I think is important. We're not consultants. I mean, we do consultant type work, but we do the implementation, we do the continuous management, which is, I think, what separates us from a lot of other vendors out there in the market.
Got it. So you said it can be as quick as 15 days. So that's actually, not too hard to stand up. Is there any cost for implementation?
Typically, if you look at it, there's a couple things that we were really very conscious of when we developed the program. First and foremost, for us, we have developed a program that has no monthly or annual retainer fees. Everything is done on a per case basis, which we think is very important because as we implement a lot of these solutions for our clients, part of our goal is to, again, reduce injuries from happening, which means if they go 3 or 4 months without having an injury, it doesn't cost them a penny to have us on standby when they do need us. I think that's very important. Depending on the nature of how their business is set up, whether they have just brick and mortar facilities versus project-based, that comes into the development of the clinic network. A lot of our clients, we feel like it's very important, especially when we're dealing with panel states, we set up the clinic network for them that's complying with all the different state regulations. And that is the only upfront cost that we associate with the development of the program, is setting up the clinic network. It is still very cost effective. Our approach has always been, we just want to cover our costs associated with developing the network, because we look at this as a partnership and we don't want these costs to be exorbitant for a company to be able to implement the program. So really, the only thing up front is their time and whatever costs are associated with setting up the clinic network.
Got it. And I know we have some folks joining that really big organizations, lots of facilities, lots of complex stakeholders. Is this something that has to be big bang, everything all at once, or can you do pilots, side by sides? How do you do that?
I typically, we do have both ends of the spectrum. We do have a lot of clients that just say we want to do it all at once, which we obviously are more than capable of doing. I think, and I don't want to speak on Sandy's behalf, I actually really like when we start with a series of pilots or a region to start with, because there are always something kind of variables that come out of it. There are different things that get added after the fact. Well, it's a lot easier to do that with a pilot location or region first. That way we can do any kind of tweaks or modifications of the program, get it performing exactly the way they want. So then as they add on regions moving forward, it's a actually complete program taking into account these new variables that they've decided to add on to it.
Got it. And yeah, I like those big adoptions because I like the revenue, but yeah, I can see why, from an employee experience standpoint, and getting a really well-developed program, running those pilots, doing, phased rollouts, can be beneficial if you've got, hundreds of facilities.
And it is. And one of the things that we've actually seen with some of our clients that have done the pilot is even just feedback from the employees, where once they've had an experience with it, some of their feedback to the employers is, boy, it would have been nice if you kind of rolled this out to us. And that's where Sandy and I have now gotten involved in even doing things like toolbox talks to the employees, educating them why this employer has made the investment into Examinetics, not only to make sure that they're getting proper care in a timely fashion, but that they have a resource that they always have access to. And what we've seen is that by working through these pilots, they're getting feedback from the employees so that they can adopt some of these other training scenarios like these toolbox talks that have made the implementation into additional regions that much more efficient.
Got it. That's very helpful. Well, I think Mike, Sandy, this has been very helpful. I really appreciate you going through this, but I'm sure we have folks on the line that would find a solution like this appealing. So, what are some of the things that companies should be considering, if they're looking into adopting a solution like this?
I think when a company looks at adopting a solution like this, a couple things they need to look at is what are they currently doing? Are they trying to manage this internally? Do they have the proper subject matter expertise to navigate some of these difficult decisions? If you see some of the scenarios that Sandy has to deal with on a daily basis, they are not straightforward. It's not just the sprained ankle. There's a lot of different nuances that go into it. And the other thing that I think employers are seeing more and more is employees interact differently with us than they will with the employer as well. When you have a third-party resource like Examinetics, and they know they're talking to a medical professional who's giving them advice, it's taken very differently than the safety person who might give the exact same advice. Ice, ibuprofen, rest it over the weekend, see how you feel. If a safety person says that versus Sandy in her position as a certified occupational health nurse, it's amazing how different that message is received. So I think that that's a big part of looking at it between internal and external resources. If you're using an external resource, I think it's one of those things where you just have to really understand is what is that value of that external resource providing you. Insurance companies have different aspects of their programs that they implement. Unfortunately, for a lot of our client companies, they have not performed to the level because a lot of times the insurance company programs don't always give the same results that we do, because at the end of the day, the employers and their employees are our client. They are our number one asset that we are trying to take care of. The insurance companies sometimes have several different metrics that they perform against. So at that point, when you look at it, whether it be, an insurance-based program versus another vendor, are they doing everything in totality to assist you in the overall program? And I think that's really what differentiates us from our competition.
And love that. I completely agree. That's one of the things I really like about our culture and focus is it is employee first, but I'm sure that some of the folks on the line will have to justify the investment. So what are the talking points that you might reinforce for people that might have to sell this internally?
I would say that, when Sandy and I and the program development team are interacting with our clients, it's really when we have a chance to do that evaluation of the last 3 years loss run data. That's where it starts because we are able to really take our program, overlap it to historical data to show a financial impact, which is typically pretty significant. Then you start taking into some of the metrics of as you implement the tele-triage and you take away some of that lost productivity. We even get involved in assisting our clients well after the injury is closed, helping them review their reserves. We get involved in those aspects because those reserves that stay on the books too long are again negatively impacting their insurance premiums. So we do that evaluation. Just even to the point where we have a lot of clients that are US based, but they operate in Canada, Mexico, Dominican, Puerto Rico. We have the ability to utilize our tele-triage program literally worldwide, and we are currently. And not only does Sandy and her team have the ability to do that, but we've incorporated things like translation services so we can have translation in over 200 languages. That way, these employees can talk in their native language and just really add to that experience they have. So I think when we look at those talking points, it's assessing internal versus external capabilities. And are those current external really delivering on what the company is trying to achieve for their injury management program?
Got it. Well, thank you. I would love to open it up to Q&A. Right? We've been monitoring the chat. There's a couple of things. Sandy, I know you mentioned a question that came up about a New York State level regulation. I think this is a great example of the depth that we go into during program development for these injury management programs because Mike mentioned the difference between Illinois and Indiana, but every single state has state by state requirements. So I think what the specific question was about tele-triage requirements and a requirement for an in-person visit. Is that right?
Yeah, so that actually applies to telehealth and somebody who is being seen for telemedicine, not tele-triage. So an employee does not require an in-person exam as part of this program. They would require an in-person exam if they don't meet the first aid criteria.
Got it. Awesome. Thank you for clarifying.
Mm-hmm.
So another question, I think really good one for you, Sandy. How successful are you at getting those clinicians to treat an injury as first aid, if and when an employee does have to go to a clinic?
We are about 60% successful in keeping anybody that goes to a clinic under the first aid umbrella as well. We develop relationships with providers across the country who we trust them, they trust us. So it's really helped keep that 60%, non-recordable.
In addition to that, too, one of the things that we do trending for our clients as well, and we started doing this a number of years ago, is we also will track what is a condition-triggered recordable versus a treatment-triggered recordable, because that's really important for employers to understand as far as we get to the root cause and the severity of injuries. There's sometimes that it's just the nature of the injury itself that's triggered the recordable. You have a broken arm, you have a broken finger, you have a dislocation. That's a recordable regardless of the treatment that's associated with it. And one of the things that we've started to do, and I think it's really benefited our clients, is having them understand as we go through the process, what is a condition triggered versus treatment triggered. So as Sandy said, we're keeping about 60% under the first aid umbrella, but if you start breaking it down from the standpoint of what was condition versus treatment, now under the ones that we have more control over from treatment, that percentage that we're keeping under the first aid umbrella is actually significantly higher, because that's where that foundational information that Sandy and her team discuss with the providers really can impact on how the outcome of these injuries occur.
Got it. Very helpful. So Sandy, another question about your team. would a customer have a dedicated case manager, workers' comp, claims manager for the account?
So we try to keep continuity of care up. Once an employee falls under that tele-triage program, we have a separate tele-triage group and a separate case management group. They will likely be following up with the same person under the tele-triage program. Once they go to case management, they do follow up with the same person, have a dedicated person for that injury. So it's more injury specific as opposed to account specific.
Got it. So it's per incident, but
Correct.
An employee is always going to be working with the same person through their course of care. Is that right?
Absolutely.
Got it. Well, here's an interesting question. What happens if an employee refuses to work with one of our professionals or a clinician?
It's happened.
And a lot of it depends on the state they're in too. I mean, that's really one of the controlling factors. If it's in a state where, as the employer, and then as us as an extension of the employer, we get to direct care, obviously we have a lot more say in what the employee can and can't do. If it's a state where you don't have the ability to direct care, then obviously that's really where we focus a lot on that interaction with the employee, where they really truly believe that they are going to get the optimal care through the Examinetics program. Now, if you have an employee, and trust me, they give us signs when somebody starts rattling off the workers' comp rules and regulations for the state, trust me, that puts a red flag on our radar pretty quick. And that's the type of things that we get involved in with our claims investigation, and we see that on a regular basis where an employee is very animate about a situation, especially when they've reported an injury that allegedly occurred 2 weeks ago. This is where that communication with our client companies is so important, that we can do our due diligence to help them through the process. But whenever possible, and our retention in states where we don't get to direct care is still extremely high. It's in the 90%. So I think we do a very good job on that. But when an employee is typically that animate, there's typically a reason, and it's not normally favorable for the employer, but we can still help them navigate the process.
Got it.
And
well, speaking of difficult, I'm sorry, Sandy, go ahead.
Just in addition to that, we do also have physicians on staff too, that we have pulled in, if we feel that it's something that they could maybe keep under the tele-triage umbrella. We also have pulled them in, especially if there's like a cultural reason for why they're not speaking with a nurse or something.
Got it. Well, another question about employee complexity, right? So how does this service work with unionized workforces?
Typically, we've actually had a very good rapport with the unions. It's one of those things where giving access to the employees to communicate with us on a regular basis gives a comfort level. There are some states that are a little bit more difficult, especially with the legalities that go into it. Illinois is another perfect example, not to pick on Illinois, even though I used to live there. But I mean, you go to Illinois and you'll have a doctor and a lawyer in the same office, and, slight conflict of interest. Those things are going to happen. You're not going to solve that overnight. But as long as we are very consistent and that employee and the union truly understands that we're working in their best interest, we haven't had a problem with it. And in fact, some of the unions have actually been the ones that refer us to other contractors because they feel like we give them an optimal level of care.
Got it. So another multi-stakeholder question, right? But Mike, how is this different from using an insurance company or a TPA for injury management?
So the insurance carriers and TPAs operate a little bit differently. And a lot of this comes down to what is the client trying to achieve. A lot of times when companies are trying to integrate tele-triage, it's not only to provide a higher level of service for the employee, but it's also to treat a fair amount of injuries under that first aid umbrella. and lose some of the transparency that gets used against them with the insurance carriers. The problem with a lot of the tele-triage programs developed through the insurance carriers is you have full transparency on the even most minor of injuries. I mean, you could have somebody who has a jammed finger, but if you call the insurance company to go through their tele-triage, now they're going to document that, they're going to categorize it as a near miss, and it's still going to count against you when they do your insurance premiums at the end of the year, because they're going to say, well, it was a near miss today, but tomorrow that could be a broken finger. So you are making everything that happens in your workplace, no matter how minor it is, completely accessible to that insurance carrier. Not to mention what we've seen is most insurance carrier-based tele-triage programs are maybe averaging 7 to 15% retention under tele-triage, whereas Sandy mentioned earlier, we're closer, we're in that 60% range. Well, just imagine how that impacts your numbers at the end of the day. And the other part of it is when you look at the third-party administrators, you look at the adjusters that are assigned to those, they typically may be working on a caseload of 200 injuries. How much personalized care are they giving to one of your employees to work through the injury process? Sandy, on average, what is the caseload for one of your injury administrators or your injury case managers?
Right now, about 40 to 50.
Okay. So we are about a fourth of what the third-party administrators have. That allows us to give that personalized, ongoing evaluation and care to these employees in a much more proactive way. I mean, when we work with a lot of the insurance carriers and the TPAs, they actually ask us to stay involved because of their caseload. They know they can't stay on top of everything with what's going on with the clinic, what's going on with the employee, what can the employer accommodate from a duty status standpoint. That's where we come in play, and that's what makes us different to either be able to take on these roles or to complement what a company already has in place with their current insurance carrier and TPA.
Got it. Okay. Sandy, I have a couple of questions here that are all really related to employee experience and the incident response itself. So first one, how long does a typical call with one of your professionals take? And is there any wait time?
There is not any wait time. You're connected to a live person immediately. Typical call, depending on the nature of the injury, about 15 to 20 minutes. So from start to finish, there might be, if it's a laceration that we need to kind of tell how to put steri strips on, might take a little longer. Average is right around 15 to 20 minutes.
And that's 15 to 20 minutes versus sending somebody to a clinic. It could take what, 3-4 hours for a first aid? Yeah. Even for something simple like steri strips. Got it. Okay. And then similarly, I think you provided one or two of these, but any other examples where when we're working with our clinicians, how do we guide them to non-recordable courses of care?
Sure. So we have something that we utilize called the NICE machine, so that they can do a little bit more in-depth icing to help with any swelling that would then prevent a need for prescription medication. We also steri strips, requesting steri strips instead of sutures, doing a lace up or soft brace as opposed to a rigid splint for an ankle brace. Those are the main things and also a home exercise program instead of physical therapy.
Well, and I think to add on to that, I think one of the things that Sandy and her team do a phenomenal job is, and this kind of goes to that foundation, because we know and understand the essential functions of the job position and we know all the peripheral tasks. An employee might go into a clinic and, the doctor might say, my only concern is I don't want him really lifting, waist to shoulder of this weight amount. Well, by us knowing the essential functions and the frequency, it may be a situation where his follow-up appointment is 3 days and he's not going to be doing any tasks associated with that in the next 3 days. So now instead of having to put a restriction in place, we can keep him as work is directed or full duty, keeping under the first aid umbrella. Just because of that communication, Sandy has had both with the employer to understand what the task the employee is going to be doing for the next 72 hours, conveying that to the physician, so now they have a good understanding. So now from a duty status standpoint, that completely changes the outcome, and that's a huge aspect of what we do day in and day out.
Got it. Sandy, another one that a bit specific, but I think it speaks to something very important. So we had a question that is, if an employee stepped on a nail, would you automatically send them for a tetanus shot? And I think, what I think is interesting here is, are we trying to reduce care or responsiveness to incidents when they come up?
We are able to even care for somebody who stepped on a nail without a clinic visit. So we utilize local pharmacies to do the tetanus vaccines, and then just keeping a good eye on that with video calls or pictures from the employee. So if they go in that situation, if they go into a clinic, they're most likely going to get prophylactic antibiotics, even though most of them never get infected. With this, we're able to keep them under that tele-triage. They can go into a CVS or Walgreens, get a tetanus shot, and then they're good to go. They appreciate that they don't have to, they can do it on their time, not during 8 to 5.
But what I'm hearing is, we're not avoiding care, right? We're not trying to reduce the employee experience or reduce the care that is being provided. It's finding ways to reduce recordables while having the same employee outcome and experience. Is that fair?
They still get very appropriate care, the same care that they would require in a clinic visit, but they don't have to go into the clinic. So we make sure that they are taken care of in the most appropriate manner possible.
Fantastic. And Mike, I have one more question here that I think is a good one to close us out. We've got some existing customers on here, it seems like, from the questions. How does an injury management program interact with some of our on-site compliance services?
So from the on-site standpoint, obviously, most of the time when we're doing the on-site, we're doing mainly with regulatory compliance that plays into it. So one of the things that you will see, however, with the injury management is that you can use the on-site as an educational tool to inform people of, basic things. We can even tie in when we're coming on site to even do proper, lifting techniques, different ways to interact with their job position. We do now have facilities where we're staffing people in those positions to provide first aid, ergonomic type care where we're trying to prevent injuries from happening. It's not going to necessarily impact what you're doing for your audio testing, your respirator testing, things like that. But we also see a lot of companies that do mass hiring events where we've even been able to tie in, like I said, even doing things depending on what the client's capabilities are to do physical ability testing and so forth as part of that. But I definitely think it's an opportunity to do a lot of education around the injury management program and what we can do proactively for the employees on their benefits.
Got it. Very helpful. So I do see one. I've got a bit of a bias on it, but we have a question here. What organization do you recommend for tele-triage?
I'll let Sandy answer that one.
I mean, again, I'm a little biased too, but I'd say Examinetics has provided the best.
Yeah, I put my money on Sandy's team personally. Well, I know we're just coming up on time. I think we've addressed any questions from the audience. So, want to say thank you again, everybody, for attending. We really appreciate it. We hope this was informative, and we thank you for your time.
Thank you, everyone.
Thank you.